And so finally, before we break for lunch, we have our West Coast team. Wassy Tesfa, who's joining us, is the Divisional Director for Pacific Clinic's Head Start Early Head Start with over 20 years experience in Head Start. Wassy is a child advocate and started her Head Start career a little while ago as a disabilities coordinator. Pacific Clinic serves 612 children in multiple program options, including center-based, home-based, and in innovative partnerships with community organizations. Her program is excited. They have their award in hand for a new Early Head Start childcare partnership to serve an additional 120 children through childcare partnerships in centers and family childcare homes. Wassy has a master's degree and is a former National Head Start Fellow, UCLA J&J Fellow, and a board member of the Region 9 Head Start Association and NHSA in the past. And the two-generation model that Wassy will be presenting is actually itself an Early Head Start childcare partnership. And here to present with her is her childcare partner, Hector LaFarga Jr., Executive Director of Mothers Club Family Learning Center. While I refer to them as a childcare partner, they're actually much more than just a childcare provider.
Yes.
Hector has spent his entire career ensuring that underserved populations have access to the education and opportunities they need to succeed in school and in life. At Mothers Club, Hector is responsible for the agency's business operations, service delivery, strategic planning, fund development, and much more. Previously, he worked for Big Brothers Big Sisters of Greater Los Angeles and did Inroads, a national nonprofit with a mission to develop and place talented minority youth in business and industry and prepare them for corporate and community leadership. Early in his career, he taught at Don Bosco Technical Institute and Salesian High School, and he currently serves as a Human Services Commissioner for the City of Pasadena and sits on the boards of Latino Heritage and the Pasadena Latino Coalition. Wassy and Hector.
Thank you. Talk about pressure here. Yeah, I really am humbled to be here today because, I'm preaching to the choir. This is the Head Start community. Head Start is innately a two-generation program, so I'm just, we're just going to start and talk about this information so that we can compare notes and see what's being done elsewhere, okay? So Pacific Clinics is a behavioral health care organization, and it began in 1926, and serving families, children, the whole lifespan, so from cradle to grave. And we serve about 20,000 families in the whole area, and diverse languages, mainly Spanish, Armenian, Mandarin, Korean, all kinds, you name it, you find it in Pacific Clinics. 30% of our clients are children and teenagers, and we have a special emphasis on early childhood intervention. The Birth to 5 program is mental health services to Head Start in the neighboring areas, and with our Head Start program, we serve about 600 children. So I just start from our Head Start vision, the vision of Head Start for Pacific Clinics, Head Start, Early Head Start, because it is embedded, our two-generation model is embedded in our vision. It is to provide high-quality child development programs for eligible children and families by building partnerships within our diverse communities. We empower families, promote wellness, and prepare children for school success. We take a holistic approach to make a difference in the lives of families facing economic hardships. And we are located in Southern California, and mainly in these 3 cities, Altadena, Pasadena, and Glendale. And now through the EHS childcare partnership expansion, we have the opportunity to reach across to other cities and communities. Go ahead. So I just put that in there. I'm not going to talk about where we are, but so that you can see the width and breadth of our services. So we really believe in partnerships. I know we're going to be discussing more about partnerships later, but we have a lot of, we provide services through not only just standalone Head Start programs, but also through partnership programs in the community. These are not necessarily state preschool partnerships. These are all kinds of different partnerships with private nonprofits. For instance, Altadena Christian Childcare Center is a preschool that serves mainly, you'd say like affluent families, including Disney and all that, but then the low-income families are our Head Start children. So So that's really wonderful how kids, are served side by side, and everybody benefits from what we bring and from what the school brings. And then the other one is Glendale Community College. At Glendale Community College, we have two programs. One is in the regular community college, where we provide, in a lab school, early Head Start services, and also partner with LAF. And then there's the Glendale Community College adult program, and that's where we do a lot of, we serve about 20 families there, and that's where we do a lot of two-generation activities with the families in the Glendale Community College adult program. And then there's Mothers Club, which is really very, very exciting, and I'm not going to say anything about it. Hector's going to talk about that later. And now with the expansion, we've expanded to Pasadena Day Nursery, which is located in really a very, very impoverished part of Pasadena. Maryvale, where we will be serving, which is also, maybe you would say, a lot of affluent children would go there, but we're going to be serving 24 early Head Start children in the partnership there. So we're very, very excited. Not going to go over the details of all these partnerships, but I just want to show you that that is really, that's a value for us to serve children in partnerships. And then, of course, on the next slide, you will see that we have home base, and we're going to be also going into family child care homes, which is going to be an adventure in of itself. But we're excited. Those of us that got funded, we asked for money, and they're giving it to us. So we're very, very, very happy about that, I was afraid of the negotiation, but it went well. So that's exciting. Our two-generation approach has the unique ability to lift entire families out of poverty and isolation. That's what we intend to do, and that's what we believe we're doing. It provides the skills and education both to parents and children to succeed in school and in life. It prepares every family in our program for their role as their child's first and most influential teacher. And all children will enter kindergarten ready to learn and ready for life. And we do this, like I said, through our innovative approach, through individualized services, through services for families, through different types of programs, and through different resources. We do live in a community that is resource rich, with community colleges right there, about 2 of them, and all kinds of different resources. And I'm sure Hector will talk about some of them when he talks about his program. So we see the two-generation approach as a side-by-side model for the family programs. That's Head Start, and I know everybody would recognize these things: adult education, EHS, literacy. We do a lot of degree evaluation because we serve a lot of immigrant population. The majority, I think about 70% of our families were born outside the United States. And so we help them with translations of their degrees and their transcripts. And also, one of the things that we're doing, we do have a lot of early educators, people who studied early childhood education but didn't finish, and those kinds of things. So we are talking to our community college, to maybe provide more infant toddler classes. I know that's really a problem everywhere. And in Pasadena, PCC does provide one course of infant toddler. So we're talking to them to provide maybe 2 courses so that they can have the 6 units, so that our families can also benefit from that. So that we, especially right now with this expansion to EHS partnership, then they will be able to be part of that workforce. So I'm just going to jump through some of the things that we do. We are very much literacy and school readiness oriented. STEM is very important to us, and so the STEM curriculum that we do in the classroom, we do that with the parents also. Emotional support. Pacific Clinics is really, it's the largest mental health organization in Southern California. And students, postdoc students from Pepperdine, from Stanford, they come to Pacific Clinics. They come like for 52 months, to go through their internship. Nurse practitioners, all kinds of really highly qualified individuals that that can support our Head Start families. So because of that, we have a lot going on with emotional support for both families and for children. And then case management for each family, ongoing support, referrals to special services. We have, so the parent support groups, one of the really hallmarks of our parent support for social emotional services, we have this bus that can go anywhere where the parents are, whether it be school or home or work, or we do serve a lot of families in shelters, and so there would be, the therapist would go there, and the mother and the child would be maybe in one room, and they would be observed, and she would have a mic in her ears how to work with her child. So we really do that. That's really, really very, very beneficial to parents. And okay, financial empowerment, credit repair, budgeting, all these things, and of course, leadership. Head Start offers that opportunity for parents to practice leadership, the PC and other committees. 100% of our teachers have BAs, 100% of our assistant teachers have AAs, so it's, really highly educated workforce. High quality evidence-based preschool curriculum, which will have high scope for our programs and our partners' creative curriculum, and of course we're, like I said, innovative for STEM. We were the founders of the Region 9 STEM conference, which is now, and we also partnered with NHSA to do that. Strong social emotional curriculum. I'm talking on the child side right now. And so the outcome is eliminating the academic gap early in life to level the playing field for children born in poverty. So I just want to focus on a few things that we do in some of our programs in terms of two-generation activities. CHAMPS, which is caring, helpful, active males partnering for success. This started out as a social emotional program, for depression and all kinds of things, but now it's really evolved into a really strong male involvement program with dads taking innovative approaches to doing things for themselves and their children. And then our newest apprentice teacher program, that's the program that really, I must admit, it's a two-gen program, but it started out with us wanting to have substitute teachers. And because the pool is kind of dry, finding teachers with degrees and all kinds of things. So what we did is we just threw out the net to our parents, asking them, if they had early childhood education or experience. And so we got response from our parents, and so what we developed out of that is a mentorship apprenticeship program. They're volunteering in the classroom anyway, so we're taking parents that have early childhood education, helping them go and get more units so that they can qualify to be hired. And then if we are, if we're lacking substitutes, they can come in as classroom aides and what have you. So we pay them when they come in as classroom aides the same way we'd pay any, the same salary as a classroom aide. And so it's evolved into a professional development strand for parents. And it's in its infancy stage because we just started that. And then we have advisory group. We are Cradle to College advisory group. This is a group, it's also just starting, where members are parents, community college professors, school district teachers, and what we're wanting to do is, because it's very hard to do longitudinal study with our school districts, we're not so lucky as the previous speakers, so we're trying to do this through the parents. And one of the things that we have applied for is for funds to put into a college fund for the children. So to start them off with a college fund, it does not have to be a lot. It could be $50 or something. And so work with them and become an advocacy group together with these parents. We have a summer program for high-risk families. And this program, parents and children come. A lot of our families from really high-risk families, homeless families, families that have really children with serious social emotional issues. And so we bring the parents in one classroom and then the children in another classroom and work with them. And this is because what did you call it, the summer melt, because the gains can be lost and sometimes parents just drop off. So that's one thing we're doing. And we're expanding services to abused shelters for abused women, which is really, we're very excited about that because it was even very hard to even, get the address to be able to go there. So we're going to be doing the services right there. And I already talked about the GCC Adult School and Cooking Matters. I'm sure some of you here may have that Cooking Matters program, which is a program where we teach parents to cook nutritious foods and go shopping with them and those kinds of things. So we do that in all our programs. So the next page are who some of our community partners are. I'm not going to go over that because I do, that's just for you to have, and you can ask me questions about it. But with this, I'd like to introduce Hector, who's already been introduced, and I just have to say that if you haven't seen Mothers Club facilities, it's just, you haven't seen a facility. It's a green facility, it's beautiful. And the partnership, every other partnership we went to, we had to convince people about family services, about two-generation program. Mothers Club teaches us about two-generation programming and family services, so we're very excited about this partnership.
Thank you, Wassy. Good morning. Happy to be here, and just to let you know, I'm really a newbie to Head Start, only 3 years doing this work at Mothers Club, but I'm a believer, and really trying to get the organization focused on doing the work that we're doing, but also getting involved on the advocacy front. Mothers Club has been doing the work it's been doing for over 50 years, and the mission is to prepare families living in isolation and poverty to succeed in school and in life through two-generation learning programs. That's all we do is two-generation learning. So our parents and children stay at the center together for 3.5 hours. We run 2 half-day programs. We start at 8:30 and at 12 and flip that over, and the new group comes in. And we're talking about 100 families every day that come through our center. And really all the details of services that Wassy described is what we do, but we do it every single day. And yes, we're very lucky to be in the state-of-the-art learning center for the last 8 years. And for most of the previous years, it was just a morning program. But with the expansion of into this new facility, we're able to serve a lot more families. And partnering with Pacific Clinics has been key. What I wanted to really just share with you, because I think describing the program the same way that Wassy did will just be redundant, but we developed our Mothers Club story, and we called it The Power of Two. And I want to share it with you in this way because of this, over the last year, we've been able to secure over close to $200,000 in new funding for the work that we're doing. So if you allow me just to tell you about Mothers Club through this format, and then I promise we can get to lunch. So let me just put the pictures up so that it brings what I'm talking about to life. All right. So the power of two, educating parent and child side by side during the most critical time, when children are 0 to 5 years old. I'm Hector LaFarga, Executive Director of Mothers Club Family Learning Center. We serve Northwest Pasadena. That's the neighborhood that the Rose Parade will not pass through. Yes, I call it a hood. A hood where residents struggle with poverty, low education levels, language barriers, and lack of opportunities. I know that life. I've lived it, and now I am doing something about it. California has thousands of low-income children without access to preschool, leaving parents helpless and with few resources. Research tells us that without intensive parent engagement, these children are more likely to drop out of school and wind up in the juvenile justice system. That's where Mothers Club comes in, with an innovative two-generation learning approach designed to increase literacy levels, educational outcomes, and support the social, emotional well-being of both parent and child. Our vision is that every mother in our community will be prepared for their role as their child's first and most influential teacher, and that all children enter kindergarten ready and able to learn. Each day, we deliver free quality learning programs to more than 100 families where both parent and child remain on site. Children are taught by professional teachers, while mothers learn from their instructors. And it's not just mothers. Fathers also come. They learn parenting, wellness, leadership, technology, job readiness, and English as a second language. We also incorporate daily parent-child interactive learning activities. Results from our recent program evaluation show that 97% of our parents read to their children 3 or more times a week, and 85% of our kids are exceeding statewide learning benchmarks. Let me tell you about Begonia. She and her family enrolled in Mother's Club 3 years ago, isolated and with little hope. Today, Begonia has blossomed, fully engaged in the education of their children, and they thrive in school. Begonia is an advocate, an entrepreneur, and get this, a PTA president. We are proud of these results, but we have 160 families just like Begonia's waiting to receive our services. So the need in our community is critical. That's why partnerships with Pacific Clinics make sense to us, and it's the only avenue that we as an organization can continue to expand our services and impact more parents and their children through the power of 2. Thank you.
Thank you, Hector. Yeah. Questions? Well, anyway, I do want to say one more thing about Hector's facility. It is a certified green facility, and I asked him if he was going to talk about their kitchen. They have, it's just unbelievable because when you walk into, you see 2 parallel kitchens. On one side, that's a kitchen where the parents learn how to cook and work, and the other side is for where food is cooked for the children. It's just mind-boggling that, you know, all this came through foundation funds, and that's how they built their facility. And this is for the poorest, low-income families in the community. So it's just wonderful. I love it.
Thank you, Wassy. Thank you very much.
Thank you.